obviously you've got inflammation, right? Because I mean, you're tough on your body, like you work it. So that's got to be one. I mean, I'm just surmising.
Yeah, well, I mean, I can tell you, and that's why it's so important to know your body and to get a wide range of lab tests, but also know how to interpret them appropriately. Because I've had a CRP done, and my CRP is really low. So, based on that, my inflammation is low. But
that's good.
So that's why it's important to get an overall picture. You can't base any. In my opinion, although we do it in Western medicine all the time, you can't base a diagnosis on one lab test.
Absolutely not.
And when we talk about insulin, I'll talk about that a little bit.
No, but I do think one thing, especially for someone like Shawn that trains a lot, when you start getting into the place where inflammation is high, it probably means either you've trained too long, or we need a break, or we need to pay attention to some of the signals that are happening, because when you have intense training for a long period of time, you hit a point where your body says no more.
Absolutely. And we actually just discussed this, and I apologize for my appearance. Actually, I came from a live workout this morning on a YouTube channel, and we were actually discussing that. It was about, sometimes, doing that crazy cardio every day and you think you're doing good for your body. Sometimes you're putting more oxidative stress, you're putting more stress on your adrenals, and you're actually stressing your body out. You're not doing good for your body. You can actually be doing harm. If your body's wiped out and you're tired, you need to give your body a rest sometimes and say, okay, there's other workouts where maybe we can just have a recoup day and do something that's more gentle on the body.
Recovery is when we get stronger, not when we work out.
Exactly. Absolutely. So, so another thing too, your sodium ratio, we talked about your sodium being low, so that could be throwing your ratio off as well. And then when they start talking about like kidney and liver issues, so, could it be if you're dehydrated, could you be forming kidney stones, something like that. So again, they're looking at a big picture. Again, this test is not a diagnostic and it's not the end all be all, but sometimes it just points to different things that could possibly be. I know one time I was going over this test with a very healthy 40-something-year-old, and when I was reading the results and I went through them, and I'm like, you don't have any kidney or liver. It says kidney, liver, but you don't have that. Like, I kind of blew through it, and she was like, well, wait a second. So we share a client, me and my one friend is a massage therapist, and she said every time that she massages me, she always says, I feel crunchy around my kidneys. So I don't know if that's something where it could potentially be that she's having stones or something that's maybe in the future, but she said, actually I do. So it was kind of weird when I pointed it out that her level was off there, that, that there could possibly be something going on. Again, not diagnostic, as pharmacists we stay in our lanes, but if there's ever something that's a red flag to say, hey, maybe we should revisit this and take a little bit more into, further testing. But again, I would imagine that level for you would be off because of your sodium level being so low, and just kind of replacing it with hydration, and I bet you that would balance itself out.